How different would a surge be, given that in February and March, in the last surge, it was still clearly centered in Metro Manila? And then fast forward to now, where it's more spread out. You have more centers, not necessarily on the same level where NCR was before. But so therefore, a surge before where you had one very clear epicenter versus a surge now where Metro Manila now accounts for what? Is it still less than a quarter of the total cases?
Right. Right now, Metro Manila is accounting for an average of 15 to 16% of the cases. So medyo mababa siya.
Yeah.
But,
So how different would the character of the surge be, given that and given the situation in March?
Right. In situation in March, NCR plus accounted for, I think, 94%. I mean, including Calabarzon. I mean, parts of Calabarzon and Central Luzon. So 94%. So yung 10,000 cases natin nun, almost all of it sa NCR plus. So right now, it's more distributed. So we're accounting for only about 15% in the NCR, 15% of the national cases. So ibig sabihin ngayon, kasi maraming naging hotspots in Mindanao and Western Visayas. So NCR is just one of these. Pero if we have a major surge in the NCR, talagang, the 10,000 is just actually yung parang starting point. So it was a fairly, fairly conservative projection. So we could be seeing, upwards maybe, 15 to 20,000, for example. Pero yun, syempre, we should allow it to get to that. Ang nangyayari kasi ngayon, not just NCR, but Central Visayas is also seeing an increase in cases. Yesterday, pinakamarami sa Cebu City, 287 cases yung na-report nila. So, I mean, that's a significant number. Number 2 yung Manila, City of Manila. So we might have two coordinated epicenters right now, Central Visayas and NCR, if this happens. Yung sa Central Visayas, it's actually happening. So yung sa NCR, it can still be mitigated. Of course, yung Central Visayas, they can mitigate it, but they need to be very active to control the surge there.
So yung spread ng hotspots in other parts of the country, doesn't that make it more difficult for government to respond compared to having it only in, for example, NCR, like nung February and March?
Yes, definitely more difficult because if it's spread out, if we have several hotspots, we can't use the strategy na ginagawa natin dati. We can reallocate some resources. For example, in nag-surge na sa NCR, wala namang surge anywhere else in the Philippines because 94% of the cases were here. So they could reallocate, they could lend some nurses. And ngayon, if Cebu City is also having a surge, we are having a surge. Cases are still high in Davao. And then Cagayan de Oro, they're still high. I mean, nag-slow down na, but it's still high. And then we have also a surge in Lawag City. So everywhere na, parang, it's going to be more difficult to control it pag nangyari. That's why siguro prevention is the best strategy at this time.